11 o'clock tonight, a closer look at the data that can tell you how Indiana is doing when it comes to the spread of COVID-19. We've spoken with countless people over the last 5 months impacted by the coronavirus.
And from doctors and nurses to survivors and families grieving for their loved ones.
We continue to learn new things about this virus.
So the people that are coming are very, very sick.
Testing should have been done so long ago.
People need to think of not just themselves, but of everyone else around them.
But despite all of these stories, there are still some who want to do their own research to see if this virus is as serious as those in the medical community say it is. RTV6's Cornelius Hawker shows you the best place to do that is the Regenstrief Institute's COVID-19 dashboard.
This is the Regenstrief COVID-19 dashboard.
The reason we created it is because at the beginning of this pandemic, many people wanted to know information about, where the virus was happening in the state and how many people were hospitalized.
That's Dr. Brian Dixon. Through his work with Regenstrief Institute and Fairbanks School of Public Health at IUPUI, he and his colleagues realized they had access to all sorts of information the public was asking about.
Now let's look at age and race and sex and because people want to know about, who's getting this virus.
The COVID-19 dashboard has a breakdown for every demographic Brian just mentioned. You can see how many tests have been given in the state, and of those, how many were positive, the testing being done by each county, and how those positive tests break down by race along with age and sex. This information is updated every 24 hours.
That's why we created the dashboard, was to take information that was coming in electronically in the state and being able to rapidly make it available so that people could track the disease.
Another useful tool on the dashboard shows trends in the state. All this red right here means positive tests are increasing, along with emergency department visits, people being admitted to the hospital and ICU, along with deaths. Brian tells me that data speaks for itself, and he hopes Hoosiers decide to do something very simple, wear a mask, to help turn those trends around.
The mask is there to protect you in case you have it from giving it to other people. But when both people are using the mask, it can essentially reduce the risk of transmission to almost zero.
Working for you, Cornelius Hawker, RTV6.
And Dr. Dixon also says wearing a mask and social distancing can greatly reduce your chance of getting the virus. You can find a link to the Regenstrief Institute's COVID-19 dashboard in this story at theindychannel.com.